Good evening and welcome to my How Healthy Are You educational call. My name is Dr. Thomas Brewer. I'm a PhD chemist. I'm going to start the call by answering two separate questions from listeners during the past week. The first one is for Alita, and it's all about acid stomach, and this is a really good topic for everyone to take note of because at some time in all of our lives we end up with pain in our stomach due to excess acid formation. So the first thing is to realize why the stomach is acidic. So the reason is our body makes an acid called hydrochloric acid, a very strong acid, and this acid is produced by minerals in our body, so we need to consume minerals to make this acid. And the acid then is there to lower the pH of the stomach, which then readies it to digest proteins. So the acidity in the stomach is a necessary step in order for this wonderful machine, the human body, to be able to digest proteins when you swallow them. So you tend to digest carbohydrates in the mouth, and that's why you should keep juices in your mouth a long time before you swallow them. But we digest proteins in our stomach. So this acid gets produced, and it makes the conditions in the stomach just right to digest proteins. And the reason we can digest proteins in a timely manner is the pancreas releases an enzyme called protease. So it sounds like protein, protease. It ends in ASE. And this protease enzyme is activated by the acidity in the stomach. Without that acidity, the enzyme wouldn't be activated. Now, when our body produces hydrochloric acid, which is really just a signal for the pancreas to release protease enzyme, if the pancreas cannot give the stomach enough protease enzyme to digest the protein that's coming in, well, then the body makes more acid. So it's almost like our body and our stomach is yelling at the pancreas, please give me some more protease enzyme. But if the pancreas can't do that, and that's just due to the organ being overworked, old, inefficient, toxic, well, then the acid keeps building up in the stomach. And you have that pain, acid indigestion. You could have some sort of burping where you get an acid reflux, where the acid actually comes up the esophagus and can even burn all the way up to your mouth. So logically, you would think that what you need to do is take something to lower the acidity in your stomach. That would make a lot of sense if you didn't know how the body works. Well, now you do know. So now you should be asking yourselves, why would I want to reduce the acidity of my stomach? All it's going to do is ramp the acidity right back up because I never gave my stomach the protease enzyme that it wanted from my pancreas. So the real solution to high acidity in the stomach is to take a protease enzyme or a plant enzyme or some plant enzyme blend that has a lot of protease enzyme in it. That way, the body gets what it wants and it doesn't have to keep dumping hydrochloric acid into the stomach. Well, what do people do? The opposite. They take some sort of antacid, meaning anti-acid, so something that decreases the acidity of the stomach. You get instant relief, but then it's gone again. So now you have to keep taking the antacid, and you'll end up taking it the rest of your life, which will hinder your body's ability to digest proteins the rest of your life. And you'll notice your muscles getting smaller, and even your heart, which is a muscle, will get weaker. And all because you're preventing your body from digesting proteins, thinking the quick fix is to lower the acidity of the stomach. That's not how you do it, because that acidity served a purpose, and all you have to do is give your stomach what it wanted. It wanted protease enzyme. There's another thing you can do to decrease an acid stomach, and that is to eat foods that don't require a lot of acidity to be digested. That's where fruits and vegetables come in. Back to fruits and vegetables. These are the great foods that we should be consuming a lot of, and most of us do not eat enough fruits and vegetables. So the average person eats a huge amount of meat and a small amount of vegetables, and some meals, 0 vegetables. I mean, think back. How many meals have you had that's been essentially meat and potatoes, meat and a starchy carbohydrate, and no vegetables, no fruit? So no living food. And these living foods are much easier to digest, and they're naturally alkaline. Now, we don't want the stomach to be too alkaline because we need it to be acidic just to digest any proteins, but it's much easier on the body to consume alkalizing fruits and vegetables, and that will also diminish stomach acidity. You've got to eat protein. If you don't, you're going to lose lean body mass and you'll wither away. So when you do consume protein, even plant-based protein, like in beans and rice and seeds and nuts, you want to take enzymes. And over time, your body will accept the fact that you're giving it what it needs, and it doesn't need to keep ramping up the acidity and ask for protease enzyme from your pancreas. Now, while you're doing this, while you're taking enzymes, that will essentially solve the acidity problem once the body accepts you and trusts you, and you do it enough time. And that typically takes sometime between days and weeks for your body to accept the idea and the consistency that it's going to get enzymes when it needs to digest protein. But the other thing you'll want to do then is to heal the pancreas. Again, how do you heal an organ? Typically, you stop consuming toxins. So you would decrease the consumption of processed foods, which are very hard on all of your organs, especially the liver, the pancreas, the kidneys, and drink more pure water and eat more fruits and vegetables, which was part of the solution in the first place, was just eating more fruits and vegetables. So we end up, as we age, getting increased acidity in our stomach just because as we age, the protease enzyme production is decreasing from our pancreas. And eventually, it's just not enough enzyme production to digest our food, and so we have upset stomachs, and then the body wants to put in more acid, and the organs just cannot comply, and it's very uncomfortable. So that's what happens, and that's the solution. It's not that hard to fix this. It's actually quite easy. If you let it go, you end up with uric acid crystal formation. You end up with very dirty, sluggish blood where the red blood cells stick together. There'll be excess proteins in the blood, which are sticky. There will also be excess fats in the blood, and it will hinder your ability to get oxygen every time you take a breath. And right now, that's something you don't want, because the COVID-19 virus does just that. It makes it very difficult to get oxygen to your red blood cells, and the transfer occurs in our lungs. So we want to make that reaction very efficient, or that transfer of oxygen from outside our body to inside our body by letting the oxygen interact with the red blood cells. So we want that to be very efficient. The next question was about a pulmonary embolism. This is for Frida. So if a person ends up with a pulmonary embolism, it's essentially a blood clot. And the fear is that it's going to travel to the brain and cause a stroke. So again, just like the acid stomach, let's look at the cause. And the cause of a blood clot is back to an enzyme deficiency, believe it or not. When the body cannot digest all of the food that it's getting, the undigested foods, proteins, carbohydrates, and fats, will get into the blood and stick the blood together, and it makes a clot. So the cause of the clot is that the blood is dirty. It's got undigested food in the blood that doesn't belong there. The Western medical solution to any sort of blood clot, whether it's a pulmonary embolism or just any sort of blockage in the arteries, is to give the person blood thinners. Well, that's not what the problem was. A blood thinner tricks your blood platelets into not functioning. So the platelets, which are part of our blood, red blood cells, white blood cells, platelets, those are the three components of our blood. The platelets' job is to clot our blood so we don't bleed out if we're ever cut, or if there's any micro tear in our arteries, which happens all the time. The platelets prevent that micro tear from becoming a big problem. So we need our platelets to do their job. It wasn't the platelets' fault that somebody developed a pulmonary embolism or any other clot or blockage in an artery. It wasn't the platelets' fault. It was your fault for not digesting everything you eat. So the solution, just take enzymes when you eat. Take enzymes at bedtime in addition to when you eat, and you can dissolve the clot. Take enzymes with your meals, and you won't form any new clots. But Western medicine will give you blood thinners, which trick your platelets into not doing what they're supposed to do. That's a bad thing. That's a very, very bad thing. It's really reckless what our medical community provides people. These blood thinners at a larger dose would kill you. Since we weigh a lot more than a rodent like a mouse or a rat, these blood thinners is what is in the bait and the poison that we use to control mice and rodents. And they just bleed out because they weigh so much less than us. I don't like using that as an example because people use similar examples about crude oil and all the different chemicals you can make from it. And they say, well, you're just eating crude oil. Well, you're not. It's been chemically modified. So the fact remains that blood thinners at high dosage are very lethal. They're lethal to other mammals. You don't want to take blood thinners because you just want to keep your blood clean, and you keep it clean by digesting what you eat and not letting undigested food get into your blood and then clump the red blood cells and the platelets together. So just take your enzymes. That's pretty much it. Now, you can also get your enzymes from, back to this, fruits and vegetables. Fruits and vegetables come with their own enzymes. Other foods do not come with enzymes, like eggs and meat and pretty much cooked vegetables. They're going to be very low in enzymes. As we age, our ability to make the enzymes we need to digest the meals we eat gets less and less. We get less efficient. So our need to supplement, or at least the possibility of the need to supplement, does increase with age. That's why you get your blood looked at under a microscope to see, do you need enzymes and how many? I've looked at people's blood in their 50s and 60s, and they're digesting food great, and they're eating plenty of protein, animal-based protein, and they're digesting just fine. I've looked at people in their 20s and 30s, and they're not digesting what they're eating. So everybody is different based on what they need to do to make sure they're digesting and metabolizing the food that they're eating. And that's why I've been very big and a very big proponent of enzymes for about 15 years now. It's been that long. And something to think about. You can either supplement with the enzyme or just eat fruits and vegetables. And just eating fruits and vegetables is challenging because that means you're a vegan. And that's a tough thing to do. So I recommend something in the middle. Usually it's a good idea to decrease your animal food intake quite a bit. That would be decreasing all meats. And by the way, chicken is meat. And dairy and eggs all come from animals. And I'm not saying you necessarily have to eliminate them. I know that's a challenge. But decreasing it while increasing your fruit and vegetable intake will give you much better health. Your body will really like it. Your cholesterol levels will get better. Your inflammation will decrease, which means your pain will decrease. Your organs will get healthier. You'll be much more efficient. You'll have more energy. You'll sleep better. Life just gets better when you eat right. So that's what I have for the introduction to today's call. I'm going to open up the call to questions. I think everybody heard that.
I have a question, Doctor.
Yes.
Sometimes it's difficult to juice the veggies and tomatoes and fruit and everything ourselves every day. What's your opinion of bottled tomato and veggie juice?
Okay, so the first thing is stop juicing all those vegetables. The only thing you want to juice is celery. Okay. So you're really missing out consuming any other juice. You want to use a blender. A juice juicing is very time-consuming. It creates a waste stream, which is the fiber, and it's a pain in the butt. But it's worth it for celery and celery juice in the morning, 30 minutes after your warm lemon water. That's awesome. That's really going to heal the body. But the other fruits and vegetables, you want the fiber, you want the peel, you want the stems, you want the seeds, you want all that stuff blended up, and you use the blender as your teeth. So the blender is simulating you chewing something. You can get a lot more nutrition when you use a blender, and it's easy. It doesn't take time or much time at all. I mean, it's very easy to throw something in a blender with some water and blend it up for 60 to 90 seconds.
Yes. Mm-hmm.
So don't juice anything but celery.
Okay, gotcha. Thank you.
Yeah, use a blender.
Will do.
And these other juices you buy, these vegetable juices, not a good thing. Not good. You don't want fruit juices or vegetable juices unless it's celery. And the celery's got to be freshly juiced. So.
Okay, thank you.
Yeah.
Dr. Brewer?
Yeah.
Is it possible to get headaches from acid reflux?
Yes, absolutely. It's possible to get headaches from acid reflux. One of the easier solutions, if the headache is from acid reflux, is to drink more purified water. That will help immensely. And you could also take an enzyme with the acid reflux and lots of water. So you're taking the enzyme with lots of water, and that headache should go away quickly.
Okay. How many
Probably
enzymes?
as good as an aspirin.
Okay. Would just one plant enzyme with the headache, you think, or more?
So it depends if you took any with the meal in the first place. So my recommendation is not to get the headache by taking somewhere between 1 to 3 enzymes with every meal, depending on the size of the meal and how old you are and what works for you. But it'll be somewhere between 1 and 3. Then you just don't get the headache.
Okay.
So it's much easier to prevent a problem than to solve it. A perfect example is cancer. It's much easier to prevent cancer than to cure someone of cancer. It's a real challenge to cure cancer. It is not that difficult to prevent it.
Okay. One other question regarding headaches. Is there a way to tell if it's from your digestion? Because I get them throughout the day, not just after I eat. I didn't know if there were certain symptoms for those particular headaches you could tell was from digestion.
It's probably not from digestion if you're getting them throughout the day, but I would monitor your water intake. And the way I recommend to do that is to fill up a half-gallon jug of water and drink your water from that throughout the day and see if you're consuming a half-gallon of water from morning to night.
Okay.
And then you'll realize, oh my gosh, I'm only drinking less than a quart of water a day.
Okay. Thank you very much.
Yes. There was supposed to be a question on the food allergy test. So then maybe that person's not on the call. Do we have any other questions?
Dr. Brewer?
Yeah.
I have a cholesterol of 269 with triglycerides of 98, HDL 77, LDL 172, and glucose 102. They sent me for a CAT scan of the coronary, and I have some right coronary artery system. They said these vessels are tortuous. However, the right coronary artery has no significant plaque or stenosis, and the left main coronary artery has less than 40% non-calcified stenosis. It says there's a mild dysphagia, which measures 3 centimeters, where the descending aorta is 2.1 centimeters. It says that the coronary calcium score is 0, and that's consistent with a 0 to 25% ranking. It says this suggests very low arteriosclerosis disease, and yet I go to this doctor today, this cardiologist, and he wants me to start Crestor. And of course, I've looked at him, and I have no intention of doing that.
Right. Could you give me your cholesterol numbers again?
Yes, the cholesterol overall is 269, but my cholesterol, I've been coming to you for years, has always been high. Maybe not quite that high, but high. The triglycerides.
What's the HDL?
The HDL is 77.
That's the problem.
What?
The problem is your HDL is too low and your LDL is too high.
Right. But you know what he told me? They don't do a ratio anymore.
Well, that's because that would be smart if they did. So who said they're smart? So that's the most important piece of information. And you've got to lower the LDL. And unless you're eating a huge amount of animal products, the reason your LDL is high is because your liver is making too much LDL cholesterol. And most of the cholesterol in all of our bodies is made by our liver. Not a lot of the body's cholesterol is derived from food intake. So what you want to do is cleanse, detox, make your liver very healthy. First step, which I already talked about, all the time I'm mentioning this, warm lemon water first thing in the morning, half a lemon squeezed into 8 ounces of warm water, about 130-degree water. It could be less warm, more warm, but basically 130 degrees is good. 30 minutes later, you're going to want to drink freshly squeezed celery juice, which will detox your liver, and it will knock your LDL numbers down as if you're taking a huge amount of Crestor. So you'll make your doctor really happy because your LDL will drop. And then the third thing to do is to wait 30 minutes after you finish the celery juice and your breakfast. Your new breakfast is going to be rolled oats, or better, oatmeal with some sort of fruit like blueberries or something like that, strawberries, something like that. And that's how you're going to start your day. And that will help detox your liver so that it doesn't make so much LDL cholesterol.
And how long will that take?
It will take about 6 months. And I recommend you do this until you're 100. If you want to live to 100, that's what I recommend you do.
And should it be 8 ounces of celery juice?
It'll end up about 6 ounces. It's different every day because you'll juice about, I'm not sure, it's half a bunch when you buy celery in the store, it's in a bunch, so that bunch should last you 2 days. So you'll notice sometimes you get more juice than others, but if you juice half a bunch, and you have a juicer, of course, to do that, but it's one of the best investments you'll make, especially to lower your LDL cholesterol. You'll really impress your doctor.
But if I were your mother, you wouldn't put me on Crestor. Is that right?
No, that's correct. That's well put, too. Because, yeah. Yes, because I can't give medical advice. So I usually say this is what I would do.
Right.
But I can't tell you what to do, but I can tell you what I would do. But just like that, I could also tell you what I would recommend for my mother.
Okay. Sounds good.
Yeah. So it's a nice little ritual. Every morning you start with the lemon water, wait 30 minutes, and have the celery juice, and wait 30 minutes and have your oatmeal. But boy, is that going to change your health. And you'll detox your whole system, and you'll end up with some very odd-looking poops spread around the next 5 months or 6 months. But don't stop. Just keep doing it, because our liver is constantly under stress because our environment is so toxic, and the liver has to purify everything we either breathe or drink or swallow in any way, any food, any drink, any toxin. It ends up in the liver, and it really takes a long time to detox, especially after decades of being around toxins. It's a very simple, natural way to do it, and basically it's free, and I like free because you're going to eat something anyway. So if you just eat the right food, it's essentially free.
Okay.
So
how important is the hot water, he said?
what is that? How hot is the water? It's just warm.
It's just warm.
So boiling water is 220 degrees Fahrenheit. So you want it to be about half that. So warmer than room temperature. It would be just a little warmer than a hot tub.
Okay. And is it necessary that celery is organic? Can it be just regular celery that you rinse well?
It is much better to be organic, but if price is an issue, just get what you can afford. But it is better to be organic.
Okay.
I mean, if you're going to make a choice, that's something to have organic.
Okay. Well, thank you so much.
Yeah, you're welcome. Do we have any other questions? I guess we never got the question on the food allergy test. All right, well, I want to thank everyone for participating and being on the call, and I'll be doing another call next week. My trip to Pennsylvania has been postponed, but I immediately got another trip into northern Nevada, so I will be gone the weekend after this weekend. I believe this weekend we're coming up to a holiday weekend, and so the following weekend I will be away, but it shouldn't affect the conference call. All right, so again, stay healthy, and I'll be doing another call next week. All right, good night, everybody.
Thank you so much.
Thank you.